Hey guys, Dr. J here. Today we're going to be talking about the top foods that could cause hypothyroidism, that could weaken your thyroid. We're going to dive into this topic today. And again, if you have a thyroid issue, you don't want to miss it because you want to make sure you're eating the right foods. But if you're eating the wrong foods, they could also be problematic. So before we dive in, please smash that like button. I'd love to look at your comment down below. And if you enjoy the content, just please sub. All right, so let's dive in. So hypothyroidism, what is it? It's a condition where you have low thyroid function. It could be high pituitary, so your TSH levels are having to go really high to talk to your thyroid to make T4 and T3. T4 and T3 may actually look fine. It could be high TSH. That's the first thing. But then your T4 and T3 can start to drop. And so you're having low thyroid hormone outside of that, 2 standard deviations to the left, if you will. Or it could even just be TSH normal and then your low T4 and low T3. 2 standard deviations to the left. Now, when I look at things, I like to be in that middle first standard deviation. All right, so that's the first thing. So I like thyroid between T3, between 3 and 4-ish, and T4 between 1 and 1.5. Conventional medicine will go as low as 2.2 and 4.5 on one side, and the T4 will go as low as 0.7, 0.8 to 1.7 or 8 on the high side. And TSH typically we want it below 2.5, below 3. Conventional medicine likes it, under 4.5, under 5. And so we like to look at more of an optimal range in that middle 1 standard deviation left and right. Conventional medicine typically uses 2 standard deviations on that bell curve, which essentially is going to be 95% of the population fits in that 2 standard deviation kind of progression, if you will. So first things first, let's get to the food. So foods play a major important role. Your thyroid needs nutrients. So the first thing is your thyroid hormone is major protein based. You'll see T4, right? The T is essentially tyrosine. That's an amino acid. Tyrosine and thyroglobulin. Tyrosine is the basis for that. And then the number is going to be how many iodine molecules there are. And there's a process of deiodination where you take that iodine molecule off and you go from T4 to T3, now that thyroid molecule is more active. And so we need certain nutrients to do that. So some of the big nutrients is we need selenium. Selenium is the major enzyme. That deiodinase enzyme is selenium based. We need healthy liver function. So if we add in foods that are toxic to the liver, that could be a problem. If we add in foods that could block iodine uptake, that could be an issue. Pesticides and organochlorines, so any type of pesticide or conventional food could throw off your thyroid too. So we have to look at it holistically from that perspective. If we're eating glyphosate or Roundup or pesticide residue, that could be a big issue as well. Let me dive into my top 6 here, and I'll give you a little bit of insight just so you guys have a little bit more take on it. All right. So soy products are a big deal. Soy has phytoestrogens in it. So estrogens can increase thyroid binding globulin. So it can decrease the amount of free thyroid. The more binding globulin there is, it can bind up the free hormone, and then you have less free hormone. So soy decreases free thyroid hormone. Also, there's goitrogenic foods, goitrogenic compounds in soy, meaning it can block iodine uptake. So it can also decrease iodine going into that thyroid gland. So that's a big one as well. The thyroid binding globulin, and also there's a lot of glyphosate residue in soy. There's a lot of GMO soy. And so glyphosate could impact gut bacteria. And we know 20% of thyroid hormone is converted or optimized in the gut via T3 acetic acid and T3 sulfatase. So we need healthy levels of gut bacteria. So if we're doing Roundup, glyphosate, if we have goitrogens here, and if we increase thyroid binding globulin via increasing estrogen, those can all impact the thyroid. Next is your cruciferous vegetables. Cruciferous vegetables, they're really good. They're good things, right? It's not necessarily bad at all. A lot of nutrients in your cruciferous. So if we have an issue with low thyroid, we want to avoid a lot of the raw cruciferous, your raw broccoli, your raw cauliflower, your raw asparagus, your raw Brussels sprouts. So avoid the big raw stuff because that's where a lot of these goitrogens are going to be. Now, if you steam them, you saute them, you cook them, you decrease a lot of the goitrogens. So that's very helpful on that one side. Also, these foods are going to be really important to be organic. There's a lot of estrogen detoxifying compounds in these cruciferous vegetables, so we like them. It's a good thing. We just want to avoid a lot of the big raw stuff. And only if someone's really on the fence will I say, hey, don't eat those things. I would just say, hey, eat them, but just make sure we cook them, we steam them. Now, if we have a lot of SIBO and a bacterial overgrowth issue, and these foods are high in FODMAPs, that could be causing bloating and problems. We may want to avoid it, but that's for a different situation, more gut-based. But again, Most thyroid issues are autoimmune in nature. And so if we have an immune system that's attacking the thyroid, then we want to look at the gut, because that's where 80% of all of our thyroid, or all of our immune system is. Gluten's a big one. Now, gluten is one of the biggest stimulators of autoimmunity, so we want to avoid gluten. Typically, that's wheat, barley, and rye, but guess what? If you're getting rice or corn or oats, that could potentially be cross-reactive if you're sensitive enough. Now, most people at some point, as their gut gets healthier, as their immune system gets healthier, they'll be able to add some white rice in. Steamed, healthy, organic white rice typically is better. There's less anti-nutrients, but at least initially, we want to work on cutting out all grains out of the gate for at least a few months, just to try to get the inflammation down. Some of the markers we'll look at is TPO, or thyroglobulin antibodies, or antithyroglobulin. These are antibodies that attack your thyroid, and you'll see gluten increase that. So we'll want to run the TPO and the TG, the thyroglobulin antibody. Those are really important to look at, and gluten can be a big deal. Plus, gluten has a lot of glyphosate residue. Glyphosate, or Roundup, is what's used to desiccate, dry out a lot of the wheat, and they do that to prevent mold and fungus from growing. But with that, you're getting extra Roundup or glyphosate exposure, and that could be impacting the gluten. Next is going to be processed foods. Now, for a lot of reasons, processed foods high in sugar. I'm not necessarily worried about the sodium. Healthy sea salt's good. But when you get lots of processed food, you don't get the right sodium. So we want sea salt. I want good, healthy sea salt. We want the good fats. Processed foods tend to have lots of processed vegetable oils, seed oils that are going to be damaged and more oxidized. They're going to have more additives. They're going to have aspartame. They're going to have dyes. They're going to have red 40. They're going to have all these nasty chemicals in there. They tend to be low on the nutrient side too. So we want nutrient density to be there as well. And so we want foods that are high in fat-soluble vitamins, good, healthy, full-spectrum proteins. We want good minerals, good bioflavonoids, and you're not going to see that in processed foods. Now, iodine. Iodine's a good thing, but if we get too much, or if we're getting lots of seafood and we're going over a milligram, there are some studies that I've cited in my book coming out, The Thyroid Reboot, where cultures that ate more iodine, over a milligram or so, guess what? They actually had increased Hashimoto's, increased autoimmune attack. And so too much iodine can definitely increase the immune system's attack on the thyroid. A little bit's fine. So the RDA says maybe 150 milligrams or so. Micrograms. 150 micrograms. 1 milligram or above, which is 1,000 micrograms, is probably maybe too much. Some doctors will recommend, 5 milligrams and up. You got to be careful. When you increase iodine, the iodination process involves spitting out hydrogen peroxide. Hydrogen peroxide in the cells can increase inflammation and increase autoimmune attack. So you got to be careful. Yes, you need some iodine. Can you do some high-quality eggs? Can you do some high-quality seafood? Sure. Keep it on that lower 150, 250 microgram, maybe up to 500. Just make sure you're getting adequate levels of selenium, because selenium is important in that iodination process. It converts that hydrogen peroxide to water. Hydrogen peroxide is H2O2. Selenium comes in there with the iodination, pulls off an oxygen molecule. Now we're dealing with H2O, and that's benign. That's water. That's okay. So iodine, a little bit's good. Too much may be an issue. And when you're dealing with iodine, you have to make sure all the other nutrients are there. And if you are adding iodine in higher levels, food-wise, seafood, dulse, etc., or supplementation, make sure everything is dialed in with your thyroid numbers, your antibodies, all the cofactors. You're getting all the gut inflammation down. And then if you add it in, be very methodical about it. Be progressive in how you overload it. Don't just go from a small amount to a high amount, and make sure you're testing your antibodies and how you feel. All right. So definitely do that under the watchful eye of a good functional medicine doctor. And then again, certain fruits and starches. Now, this is all going to be about insulin resistance. These are very general. I'm trying to give you the nuance with it. So why would fruits or starch be bad? A lot of thyroid issues involve insulin resistance. So if we have a lot of insulin, let's say our fasting insulin's above 10, or we have lots of blood sugar issues where our blood sugar is staying above 120 within 2 to 3 hours after eating, that's a sign that your cells are resistant to insulin. And insulin is a hormone that is needed to get the glucose into the cell. So it's very important that we are on top of healthy insulin levels. Too much of it, the cell becomes numb, and then it converts all that glucose and carbohydrate and it puts it into fat. So very important that we are on top of that, and we don't do too much on the carbohydrate side. Very, very important there out of the gate. And then when it comes to insulin, if you're eating a lot of processed food is different than a healthy bit of berries or some sweet potato. So the first thing is like added sugar, processed sugar. processed flour, processed grains. And then you can go into safe starches, sweet potato, white potato. It's okay. You know, maybe you have some grass-fed butter or healthy fat or some cinnamon on it. And it's going to be about your activity level. If your activity is lower or you're more sedentary, then you have problems with that. And then the next thing would be just really focusing on having good fats and proteins together. That time releases the carbohydrate. Carbohydrate and high insulin can really impact thyroid hormone levels. If you go online and you look at type in diabetes or in insulin resistance and low T3 or low triiodothyronine, you'll find all kinds of studies with insulin impacting and causing low thyroid. So the fruits and starch stuff is going to be specific to you and your needs and what you can handle. All right, guys, hope you enjoyed today's video. If you did, please feel free and let me know you did. If you need more support on the functional medicine side and you want to dive in and be a patient, I see patients worldwide. So if you want to dive in, there'll be a link down below where you can click and you can schedule. And we're going to look at all those big factors. We're going to look at more. We're going to test your thyroid. We're going to look at everything under the hood and see what else could be going on. If you enjoyed today's video, please let me know in the comments and make sure you sub. Take care, guys. Have a good one. Bye now.